Hi, welcome to Bari Nation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hey Bari Nation, it's April. I have some really exciting news to share with you. We are this year's national sponsor of the Trio Foundation's The Walk. The Trio Foundation is not only working hard to improve access to obesity care, but they fund critical research that improve the treatments that you and I and everyone can access. And this year, their Stomp the Stigma Walk is happening on Saturday, September 27th, and Bari Nation has a virtual team. We would love for you to join us and walk together. Click the link in our bio or click the link down below in the show notes to join our team, walk with us, and stomp the stigma together. Hey friends, it's April. Before we really jump into this conversation, I just want to put this little idea in your head. In this episode, you are going to hear some amazing things that we can do to help us optimize our executive functioning throughout our day. So you're going to hear how ADHD, neurodivergency, and executive function can kind of slow us down, especially as we're trying to fight the disease of obesity. And Dr. Stewart offers some amazing things to try. We know it's one thing to know it, but it's another thing to actually practice and do it. And in the Bari Nation membership community, you can do exactly that. In our support groups, classes, and meetups, it gives you the safe place to learn about the things that we can try and then actually practice them and kind of report back to your peers. You can share about what worked, what didn't, and gain really valuable insights from people that are doing the work right alongside you. The community is your safe place to practice this work that you're learning how to do. So join us today. Head to barination.mn.co and become a member of our amazing community. All right, my friends, let's jump right into this awesome conversation. Hi, friends. Welcome back to the Bari Nation podcast. Today, we have the honor of introducing you to an expert that we have not yet had the chance to talk with. Karen Stewart is joining us today to learn more about the connections between ADHD, neurodivergency, and obesity. I know you have been wanting this conversation forever. Yeah. We're thrilled to introduce you to Karen. So, Karen, I'm going to pass the mic to you. Please introduce yourself.
Sure. Thanks for having me. I also have been wanting to have this conversation for so long. I'd say it's about 10 years that I've been really deep diving into understanding ADHD and obesity. And so, I am a clinical psychologist and I've worked in the field of bariatric surgery for about 20 years, actually. I did my first evaluation as a graduate student in 2005. And I also had Roux-en-Y gastric bypass in 2018 myself. And currently sort of maintain with Zepbound is what I'm taking now. And needed that because I did have some weight regain, especially during those COVID times, right? Anyway, so I have known for about 20 some years that I have ADHD. And yet it wasn't until about 10 years ago that I learned that it's actually more prevalent in the bariatric community. And in the last 10 years, I would say we've also been seeing that there's a lot more conversation about adult ADHD than was in the past. I completed my doctoral work in 2010, and the number of times we spoke about adult ADHD was next to zero. We talked about it in our testing courses. So that's like doing psychological testing to get diagnosed with something. But it never, ever came up in any of our treatment courses or in any of our considering, I'm a specialist in health psychology. And so, a lot of talk about depression, anxiety, and how those affect our health and our behaviors specifically. And a lot of my research in school was on how our emotions impact our moment-to-moment behaviors and how when we're in a moment of, really challenging emotion, we tend to be less creative and less open to problem solving. And we struggle cognitively and emotionally in those moments and not a lot of flexibility. And actually, this is actually a characteristic of ADHD as well, is that cognitive flexibility can be challenging. Things like switching tasks is hard. Unexpected deviations to your schedule or your routine can be really dysregulating and difficult. So in any case, yeah. So, when I learned that, it was more common in the bariatric population, I was really intrigued and started thinking more about how this affects us in our eating relationships. And I've just had lots of opportunities now since then to talk to patients real life about it. We screen for it in our practice. And
really,
it allows me to, it's not enough to give a diagnosis during that meeting, but it allows me to give them some really personalized feedback on here are some strategies that might be beneficial for you.
Wow.
It's really just such a very, as someone with ADHD, it's just been such a gratifying experience to be able to share with someone, here's what might be going on with you. And also just broadly speaking, even if someone doesn't have ADHD, we all do have executive functioning, which is at the core of the challenge of ADHD. And that is a limited resource that each of us have to varying degrees, I suppose, a certain well of energy each day. And we live in a society that's very taxing to that resource all day, every day, with decision making, having to behave professionally instead of saying what you really want to say, and having to choose the healthy food instead of the thing you really want to eat. Every adult decision you make is basically tapping that resource, and it's a lot. And so, I just really feel like that's an area that anyone can benefit from the conversation around, how do you protect that resource? How do you build it up? And what are some ways to just make life a little easier, and how to be a little kinder to yourself with the whole process.
Wow. Okay. So as you can tell, friends, this is going to be a monumental discussion. We might not get through all of it in today's recording, but Dr. Stewart, we welcome you back anytime, because we know so many people in this community are asking these questions, or they're noticing these things. Yeah, one conversation is not going to be enough. I can already tell that.
I'm here for it. Yeah.
Awesome.
I'm ready to nerd out. Let's talk.
Let's do it. Well, and maybe that is actually just a really great place to start. You mentioned that ADHD, neurodivergency, is more prevalent in the bariatric community. Yeah. Why is that?
That's a really good question. I guess it's probably because there are greater prevalence of problems in eating in ADHD. So it's more of like a chicken and egg question of those of us with ADHD may be more inclined to find ourselves needing bariatric surgery, right? And so even from a pretty young age, some of the ADHD is more associated with obesity in general.
It's like blowing my mind a little bit, because I always assumed that how I was thinking, and I know, Nat, you and I've talked about this before too, we know that we do these things behaviorally, or we are triggered by certain things, or something happens and then our response is this. And now it's well, yes, you have the disease of obesity, but maybe it's the ADHD that's driving some of those actions and behaviors, not necessarily the disease.
Yeah. Yeah. I think even before I made the connection with ADHD, I noticed what seemed like an unexpected pattern for people in the bariatric community and people struggling with obesity. I think people assume that we're obsessed with food and that we're always eating all the time, right? I think we have all been exposed to that stereotype, unfortunately. Mm-hmm. Often people are forgetting to eat. They are skipping meals. And then they are ravenously hungry. And desperate without a plan and grabbing whatever is convenient and quick. And so there's several intersecting factors contributing to that of planning and organization is necessary for healthy eating, right? You have to kind of have a plan. And if you don't have a plan, then, it's McDonald's, right? Mm-hmm. Planning isn't our strong suit sometimes in ADHD. Organization isn't a strong suit all the time, and I always mention, not everyone has every symptom, right? So I'm kind of speaking just generally here, but planning and organization, especially when it comes to food, I think are prevalent. And I think that's because you want to also think about ADHD as it's a brain that's wired for interest. And so food is actually a fairly low priority for a lot of ADHDers because there's just so many more interesting things happening in their brains and in their world. So sometimes those meals are being skipped due to hyperfocus because they're so zoomed in on a task that they don't want to pull out of the task and stop for lunch, for example. That also, I think, is related to difficulties in task switching. I think for a lot of ADHDers, there's a lot of cognitive efficiency loss in task switching. And so they're very averse to that. And sorry, that sounded really clinical, but basically like it can be overwhelming to multitask, basically. And you're losing a lot of efficiency by switching back and forth. And yet you have a brain that keeps trying to switch you back and forth, and it gets very frustrating. Mm-hmm. So I think that meal skipping, either due to, not being terribly focused on it, also low sensory awareness can be contributing to that. So not even noticing that you're hungry until it's a very strong hunger, and now you're ravenous, eat too fast, eat too much. So kind of a lot of ways, I think that that kind of chaotic eating pattern emerges for those of us in the ADHD world.
Yeah, I relate to pretty much everything that you just said. I'm like, yes, this all makes sense. I think where I finally put this together, and I remember texting April and Jason pretty immediately, I found an article that discussed the link between ADHD and obesity. They didn't say like the official link, but how, overeating can also be a stimulus for us, or, skipping meals until you're so hungry. Like there were all of these things. And I just remember feeling really validated after almost 30 years of struggling to figure out why, even with bariatric surgery, why I just couldn't get over, quote unquote, this hurdle. And everything you said just hits the nail right on the head. I don't always want to eat because I'm like, I'm doing this thing. And if I step away, this thing that I'm currently doing, this task is never going to get done again. So I'm just going to continue on. I have to set alarms at work. I have to put it in my planner, like go take a lunch, get away from your desk, because I will just keep going until I'm too hungry. And then, like you said, I just make those poor food decisions. And I was lamenting about that this morning in a Berry Nation support group on my way to work. Just why can't I make the right decision in the moment? And part of it is definitely my ADHD and my neurodivergence.
Yeah. And I think that validation is so important towards feeling more compassionate towards yourself about it, which allows you to be more vulnerable and open to seeing the pattern if you're not judging yourself for it. And so if you're able to compassionately look at your habits and say, oh, okay, here's where I am right now, and here's what I'm learning about that, so I can move in a different direction next time.
I'm kind of putting all of these things together in one. And this is the kind of learner I am. So I'm just going to summarize what I think you said to make sure that I'm understanding this, and then kind of apply what we've been learning. So we're recording this episode in May of 2025. And in May, we're focusing on mindfulness. And one of the things that I recently learned about our brain, right, is that multitasking depletes those energy storage. It literally tires and taxes our brain. Okay. So it's the more that we multitask, right, the less energy we have to be mindful and make decisions that are aligned to our goals. What I hear you saying, Karen, is ADHD compounds that because our brains aren't built to do that. But the ADHD or the neurodivergent brain is working really hard to get you to bounce between different tasks. It is taking your focus to all kinds of different places. So not only is ADHD compounding that, if we live, and we do, in this modern society where our attention is constantly being asked in all of these different places, it's like a 1-2 punch. Yeah. So no wonder why throughout your day or at the end of the day, you really do find yourself exhausted on a mental and an emotional level And it's hard to make those decisions that are aligned to our bariatric goals.
Mm-hmm. And I think in conjunction with that, I do think the ADHD brain has a lot of ideas, and many people relate to the concept of like, oh, I have like 17 tabs open in my brain at any given moment. And the name ADHD is a bit of a misnomer because it's not a deficit of attention. It's a different way of being able to intentionally control and direct your attention. And so, you're trying to focus on this super tedious task of like filling in the dots on your documentation for your job or whatever, filling in a spreadsheet or something really boring. Meanwhile, in the back of your brain, you're thinking about what you're doing later today or the book you've been reading or, probably several of those things may be in the back. And all of that is distracting and more appealing. It's a more dopamine thought, and so that's another kind of concept to talk about with ADHD is like the role of dopamine as well, right?
And in a world where like we're walking around with things, or we're holding things that are literally giving us these hits of dopamine, that even complicates it even further.
Mm-hmm. Mm-hmm.
And even like I struggled in college. I gained a lot of weight in college because of studying and the stress of it all. And I was craving the dopamine hit all the time. Mm-hmm. I had bags of candy and chips and anything I could eat to get that dopamine hit mm-hmm. was just at my fingertips because I just needed it so badly. Mm-hmm. And I think that's part of what alerted me when I read that article at first. Oh, this makes a lot of sense. And oh my gosh, I'm a bariatric patient and I can't always just reach for candy and chips and you know what I mean? So, yeah. At the end of the day, I was just talking to April before we started this. I'm like, I'm exhausted. Like the thought, thank God I meal prepped, but the thought of like making dinner and deciding what to make for dinner mm-hmm. would literally send me. I would rather not eat dinner than have to make it.
Mm-hmm. Yeah. And you hear sometimes people refer to their hyperfixation meal, like they're going to eat it over and over and over again. And yes, I think there is maybe an element of hyperfixation to that. But I think what's also going on in that scenario is almost more like it's a cognitive efficiency strategy of like, I just don't have the executive function to be making brand new decisions every day about food, right? Like I'm just going to repeat that decision. It's a strategy for protecting that resource that you didn't even realize you were doing. And so I think sometimes when you hear something like that, it makes you realize this is a behavior that I was using to protect myself, and I don't need to beat myself up over that. And I need to have awareness of that so that I can use that to my advantage, right? Of like, eating the same meal every day for 3 weeks on end isn't a problem as long as it's something you enjoy and it's pretty healthy. You can take advantage of that. That saves you a lot of efficiency, a lot of brain space.
Hey friends, it's April. I'm sorry to interrupt this amazing podcast episode with Dr. Stewart, but I have to let you know, she is a part of ATA Bariatrics, and that's one of our newest practice partners with Bari Nation. So if you are a patient of Dr. Stewart, or you're thinking about becoming one, or you see any of the other amazing therapists in the ATA system, you can access an exclusive $29 a month membership for Bari Nation. So it's around about $1 a day. And that gives you access to all of the support groups, the classes and the meetups that we offer in this community. So if you're interested in that, just open up the show notes and click the link that you see down there. We would love to welcome and support you in the Bari Nation membership community. All right, friends, let's get back to this amazing conversation. There are so many people who are listening to this. We often talk about this in the Bari Nation community. As bariatric patients of people who've been obese, we want to beat ourselves up, right? For us getting to this point in our life. But what we really stress in our community is that, right, our bodies and our minds were doing the things that it needed to do to keep us alive, right? There's nothing wrong with us. There's nothing wrong with us up here. Mm-hmm. It literally did what it needed to do in that moment. And we have to get to this place where we acknowledge and thank ourselves, our bodies and our minds for doing what it's designed to do. And what we heard you just say is really the same thing. We are doing whatever we possibly can do to survive. And these things that we have started to do are an answer or like a healthier coping strategy or skill or tool that does help us move through life as aligned to our bariatric goals as we can be, because it is doing what it's designed to do, which is get us from A to B as quickly and as painlessly as possible.
Yeah.
Wow. Okay. So you've said a couple words, and I think I just almost want to take a step back here. We've talked about ADHD, we've talked about neurodivergency, and you've talked about executive functioning. So can we maybe define what these are and then talk about how they are all related to one another?
Awesome question, because I hear kind of a conversation out there of like, why does everyone have ADHD and or autism all of a sudden, right? And there's a lot of answers to that of like, you know, we're not genetically any different than the generation before us. Same argument with obesity. Like the obesity epidemic isn't like, it's not a genetic change, right? The reason we're seeing more is because we're looking for it more is one thing, right? Like, as I mentioned, we basically considered ADHD to be a childhood only disorder, for a long time, right? And I would say it's still a struggle to get, you know, people recognizing the impact of adult ADHD. Adults with people with ADHD do live shorter lifespans. So, I mean, that's not just a coincidence, right? Greater risk of accidents, greater risk of health issues, obesity, and other things are contributing to that. Right. And so this is part of why I have this mission of educating both the public and healthcare providers. One of my goals is to start creating continuing ed courses for other therapists and healthcare providers around, you know, this is impacting your patient's health. It's a serious problem for adults that is affecting their health. It's affecting their quality of life, relationships. It's affecting their careers, so many things. And it's not just a tiny nuisance. It's something that is really affecting them. So going back, though, to the broader concept of neurodivergence, same with autism, you know, we see more of it because we're looking more for it. And I do think also we're just talking about it more. People are seeing aspects of it in themselves and relating to that. And then also there's a third concept in the neurodivergence space of giftedness that is talked about as another form of neurodivergence. And so there's something in the kind of the school, like in the educational space of like, you know, it could be like 2E, which is like usually they're gifted and ADHD, gifted and autistic, you know, they have like a dual neurodivergence. And so really, I think that, no, not everyone has ADHD. No, not everyone has autism, you know, but everyone has some things that feel relatable that might be in that broader category of neurodivergence. And this is why I kind of approach it more as a therapist, more from a symptom-based approach of like, if you're having executive function difficulties, it's not as important to me if you meet all the criteria to have ADHD as it is that I help you with those problems. The challenge there for diagnosis is that executive functioning difficulties are an aspect of ADHD, autism, and nearly every other psychiatric disorder as well. And so, you know, and then there's also high comorbidity among all psychiatric disorders. And so it's often very difficult to tease out exactly what is causing the executive dysfunction. An interesting little side note, I remember seeing something in 2020, you know, the year that we all had the best time, where adults were reporting significant increases in executive dysfunction. So no, people weren't getting ADHD, but our brains were really being, you know, overwhelmed with like just the heaviness of the world, the isolation and the stress of that time, I think is what that is. And big transitions, like suddenly I have a work from home job and, you know, is a lot, you know. Similarly, many adults were reporting weight gain during 2020 also. For me, that was just like well, this is where the snacks are. So, yeah, you know, anyway, but
Wow.
yeah, that is actually when I had a little bit of weight regain was, I made it the first year of COVID. It was the second winter, that winter of 21 that like, it's getting real tedious around me.
Well, and for all the reasons that we've already discussed, right? When we're asking ourselves to live in a different environment, to be totally different from what we've ever known. Yeah, stress levels go through the roof, and you're spending time with people that you usually don't spend that much time with, even though you live with them. The work environment changed, the home environment changed, the national environment, the social environment, everything became something that it had never been before. So then you pile that on top of, right, the neurodivergency, these executive functioning, issues or things that people are going through. It was a lot. It was a lot. And I don't think we give ourselves enough credit for just how challenging those moments were. Some people were, I think, brave and bold enough to talk about it, but everybody else just kind of suffered through it. And it was like, it is what it is.
Yeah.
Sure, it is what it is. But how do we move through this in a way that's beneficial for us and not detrimental, right, to our overall health? That was kind of the big question there.
Yeah.
So when you talk about executive functioning, what is that?
Oh, well, so this is basically like the boss of your brain, right? It's the decision maker. It's the impulse control. It's the emotion regulation, located mostly in your frontal lobe. It's basically kind of exerting control over all the functions of your brain and helping kind of organize and coordinate those different activities and intentions in your brain. And so, as I mentioned that, I think one thing that is often overlooked in ADHD, and it's not mentioned in the diagnostic criteria at all, is the effect on emotion regulation. It may not necessarily be obvious to others, but that dysregulation that ADHDers feel in those moments of unexpected transition and other types of frustrations. For example, just yesterday, we had an issue at work where our electronic health record wasn't working for about 15 minutes. And I have a pretty tight routine where, like, from this time to this time, I'm reviewing this chart, and then I'm going to meet with that person. And I'm supposed to be starting that chart review right now. What am I supposed to do instead? I can't get in. What am I supposed to do? And it took some recovery time to get back into, and then it's like, well, now I still have the appointment at the same time, but I have less time to review the chart.
Yeah.
A little mini meltdown. Well, mostly internally, but.
And that's how I feel like trying to explain to family members that don't have ADHD or things like that. I will never forget. So I upload our calendar in Bariatric, which is a very tedious task. And I put it off until the very last minute because it's just executive functioning. Don't want to do it. It's tedious. If I stray from it, it's just not going to get done. So if I have, a 4-hour time chunk, I can just get it done.
Yeah.
And I was doing that living with my parents, and my dad would come in just unannounced. And he did it about 3 times. Mm-hmm. And I finally just said, I want to punch you. I want to punch you just right in the throat. I'm so frustrated. Can you please just give me this time?
And it feels so outsized, right?
Yes.
Of like, I was just saying the other day, I was like, I can climb a mountain, but put a molehill in front of me and I melt.
Yes.
Mm-hmm. Mm-hmm.
Now that we just had this conversation, we got to see each other in person a couple weeks ago. And I remember we were talking about something and she was like getting so worked up, and I was trying really hard to just be like, okay, whatever. But she saw the look on my face, right? And I was probably like, why? Like, you're getting worked up out of nothing. Mm-hmm. And I remember she turned to me and she's like, it's just a big deal to me and I can't explain why. Right? And it was kind of what you just said.
There's no rhyme or reason, really. I mean, truly, it like you said, Karen, it's a molehill. Interrupting me 3 times in a row should not make me want to punch you in the throat. It really does.
Yeah. Well, and that has been, I think, part of the journey I've been on, especially in this last year or two, of like recognizing the ways that the way I'm doing life exposing me to more of that than it has to sometimes, right? And also just kind of getting okay with I am the way I am and I need things to be the way they are. And I actually caught myself apologizing to a colleague because I said, I'm sorry for being rigid about my schedule. And then I thought, and I texted back and I said, I'm going to take that back. I'm not sorry for meeting my routines. And it's just, I can't like fit one more thing in. I just can't. And of course I did anyway, because the patient needed me. But it was a legit need, but it's really, really hard. And it's harder than it was when I was younger because I'm perimenopausal. And, oh boy.
Mm-hmm.
Uh-huh. So, and it turns out that estrogen is actually a facilitator of dopamine. And so if you are middle-aged going through perimenopause or wherever you are in your journey with that, and you feel like maybe I do have a little ADHD, maybe it's a little perimenopause, you are not imagining that. That is a thing. So, yeah. So it's like, It's like things that used to be mildly annoying are rage-inducing now. Basically, right? Yeah, that's what happened.
Oh my God. I was telling Nat, Nat knows the story very well. I was recently diagnosed as postmenopausal, and I did a really good job, I think, of keeping that rage cage feeling internal. But it got to this point where I was really concerned for myself. I was like, something is really wrong here. This is just not good. And went in, realized, I'm actually postmenopausal, whole different story on that. But I have since started hormone replacement therapy under, strict guidance of my doctors. And I cannot believe the change that it has made up here.
Mm-hmm.
Up here. I think I definitely have some of that executive functioning things. And when you and I were talking before we recorded this podcast episode, right? ADHD isn't always about jumping from things to things. It's getting hyper-focused and it's doing all this. Anyways, I saw myself a lot in what we were talking about. And that connection to estrogen and hormone replacement and the things that I've noticed going on up here has really been monumental. And it's helped me let go of some of that guilt and shame and blame that I was feeling towards myself.
Yeah.
And the more that I learn about, multitasking and mindfulness and just all of these things are kind of coming together in this really beautiful picture that helps me explain why I'm the way that I am. And it's helping me, I guess, have more appreciation just for how I'm built. Because now that I know how I'm built, I can apply different strategies and techniques and tools that helps me maximize, right? This wonderful way that I've been put together. Instead of trying to push it away or shove it down, it doesn't work. It just doesn't work.
Yeah.
But if you don't listen to these conversations, if you're not always staying curious about what's out there, you miss some of these pieces. And that's why we're just so thankful to be able to have this conversation with you today.
I love it. And one of my favorite conversations was being able to, speak with an older patient who had never really considered ADHD. And when I shared with her that I thought that might be what was going on with her, it was visible relief of all these years, I just thought I was lazy. I thought I was stupid. I thought I was unmotivated and all of these things she'd been saying to herself. And, I think it's really important to also see the positives of an ADHD brain. It's very creative. It's usually, pretty good at if you're good at something, you are good at it. You really, that hyper focus is that really serves purpose. Usually a lot of empathy, a lot of compassion, and a lot of positives, I think, to that brain that, aren't always a fit for our traditional workspace in America, where we kind of prioritize things like being interruptible. And this also then prompts one of the thoughts I had about, being neurodivergent as a female, I think presents some unique challenges because, we're supposed to be pleasant and available, and interruptible being part of that. And so if you're edgy with people, if they're interrupting you or expecting you to deviate, that I think, there's some elements where that kind of looks a certain kind of way in the workplace, especially for female, but probably males as well. So, yeah.
All right. I'm going to switch gears here just a little bit because I know there was something we were really excited to talk to you about. Knowing that ADHD, right, this neurodivergent brain interacts with the disease of obesity a little bit different. Are there areas in which this can impact our eating as bariatric patients? And are there things that we can do to kind of work around those impacts?
Yeah. So I kind of thought about, well, there are three main things that I think you can take away from this conversation today as like kind of guideposts about what is the crux of what's going on with ADHD and how to navigate that, right? In terms of your eating. So one is the dopamine, right? Of like food is serving that role of, giving a quick, constantly available and very effective dopamine hit, right? The second is this executive functioning as a limited resource and things you can do to protect that resource. And the third part is the self-compassion part, because that actually then, circles back on itself in the executive functioning of like, the more you're thinking thoughts like, why can't I just get it together? Why am I like this? I just will never succeed with this. That judgment is also pulling from that executive function, that resource, and kind of draining that well, and basically, exhausting you more and more through the day. And so that kind of like narrative that's there of like really healing that narrative is a big part of it too. To focus more on the dopamine part, right? So it's very natural to need dopamine, through the day, right? Of course, we're not even talking about medications and treatments, like that's an option for things, right? But even with the medications, you're still going to have a need for dopamine. Even people without ADHD need that. And so I always encourage kind of, being very mindful and observational of your pattern with that, of like, when are the times of day that you tend to be susceptible to that, and plan for that. Build in things that are, maybe you do need a healthy snack at that time. And if you have that snack readily available, and it's easier to get than the unhealthy snack, especially with that hyper focus, you're going to not go out of your way to go get chips if the apple is right there. So kind of planning around needing dopamine and making healthy alternatives available. Also, maybe some other non-food related dopamine hits, like what about just getting outside for some fresh air, giving yourself permission to actually just put work mentally away for a few minutes, take a nap if you can, lots of things. And I sometimes encourage people actually to keep a list on hand of readily accessible, easy activities that you can do in a moment like that. Because going back to what I was mentioning earlier about my doctoral research, when we're in a moment of not feeling great, our flexibility is low. And so that kind of default mode of turning to food to feel better in that moment, you're not really able to come up with other ideas. And it's such an overlearned pattern that it feels like that's the only thing that would work in that scenario. And it will take time to unlearn that pattern, or to at least decrease the strength of that association and that link between this is the only thing that works. And these substitutes are going to feel not as satisfying, at least in the early stages. But the more that you build up other things, and you have to make them readily available, because that's one of the things about food is like, you can't take a break and go watch a whole movie during the workday. It needs to be something quick that you can do for a few minutes, and that, maybe it's a crochet pattern and you just carry it in your purse and you pull that out and give yourself 10 minutes to focus on that instead. Or going outside for the walk, and the list, I think, is what helps you with that lack of creativity and flexible thinking in those tough moments. So that's some thoughts on dopamine. The executive functioning, I think the cognitive efficiency we were talking about of like meal prepping, making it simple. I'm a big fan of things like rotisserie chicken, and then just put 3 different sauces on it 3 different nights. Dinner, right? I've been known to do frozen broccoli, some canned chicken, and soy sauce in the microwave for 2 minutes. And it's like, that's actually pretty good. It's not bad. I mean, it's no gourmet meal, but food was had, Food was had.
Protein heavy food was had. Yeah, even better. Yeah.
Yeah. And so like lowered expectations on the food front and like making it simple. And you don't need to be someone who spends a lot of time on food. You just need to work with the brain that you have and try and meet yourself halfway, I think, in that regard. And let's see. And then that cognitive efficiency, protecting your executive function, that is so huge. Cause like, I mean, this might mean, do you need a career change? I mean, like, are you in the wrong profession? And actually I'm looking into getting involved in, some, agencies in my area that are, helping out with young ladies in their education, and they do some personality assessment. And I've expressed some interest. I might be able to kind of help with like, I have kids, and I'm really interested in helping them figure out what's going to work for you career wise, like, and choosing something that's going to be a good home for you as your brain works. Right. And like providing that mentorship that I don't think anyone knew to give me those things, right?
Yeah. I'm so like happy and proud for you, Nat, because all of the things that Karen just said, you have talked about how you've really implemented a lot of these things in your life, and you're seeing really good results from these things. And you were doing it just because you figured out this is going to work for me.
Yeah, it's very validating to hear you talking about all of these different elements, because I have done a lot of work in the last 2 years, and April and Jason especially know how, like, I am phone on do not disturb by 7 p.m. Please, if I have something on my calendar, don't book over it or don't try to get a hold of me. Like, I'm very rigid because I have to be. And that is the same way with food. I mean, the hyperfixation meal thing I'm still stuck on that because I eat the same. I like have rotations of like, these are the things that I like to eat, and I don't stray from them because I don't have to decide. I don't have to think about what I'm going to eat. My literal worst nightmare is going out to a restaurant and me not having time to sit and decide about what I'm going to eat beforehand. Because I don't know. I cannot decide. And I've gone out to eat with April a lot. And sometimes I just let her take the reins and order for the table, and great, sounds good. Because there are moments where I just do not have that extra reserve, or I know we're about to do something that's going to take a lot more out of me. So I can kind of reserve that. It's like the spoon theory that people talk about with chronic illness, right? It's very similar in terms of like brain power and cognitive executive functioning. Like, okay, how much am I willing to spend in this moment?
Yep. Well, and I've seen you too, not like with your new job, you are walking throughout the day. I know every now and then you're like, oh, I just heard this song, right? That's something that's a dopamine hit. It could be on the list. It's something that you're like taking a break from. Here's that. So I know you're doing those things at work. You're meal prepping and you're sticking to your favorites, which I appreciate knowing as well, because it helps me too when you're offering those suggestions. But I've just seen you do so many things and make so many of these small changes, but they've added up to big things. When you travel, how you pack, what you choose to pack, when you're packing, why you're doing it, it's really setting you up for success. And I never connected it with neurodivergency until this conversation, but the changes and the things that you've implemented in your life have really been a game changer for you.
Yeah, honestly never thought I would get here, but thank God I did. I don't know.
Right?
Yeah. I mean, and it sounds like you've done the deep dive on that and you've really analyzed, what's going on. And given yourself the space to do the problem solving and figure it out.
Yeah. And I just tell, like, I traveled with Jason and his wife and our friend Tab. Never have I ever traveled with them. It's always April and I traveling together to get to them. And there were a couple times where I was like, ooh, this is not this is not how I do things. How am I going, so then I have to just say, I'm following you. I can't make a decision. Just do what you got to do. And I will follow suit, because this is not my routine at an airport or, anything like that. So it's, but yeah, it's been really eye-opening, and the topic has kind of exploded within Bari Nation too. So I know our listeners and our members will just so appreciate and hopefully feel validated too, because I've had a lot of one-on-one conversations with people.
Yeah. Oh my gosh. Yeah, this is truly just the beginning, friends. If you're listening and you're watching this episode and you're like, ooh, I really want them to ask this question, or I really want to know more about this topic, please leave it in the comments of this episode or send us an email, hello@barination.com, send us a DM. All of this information will be in the show notes, because we know that this topic almost has limitless possibilities when it comes to understanding it more and on a deeper level. So you are about to unleash a wealth of knowledge, not only to the bariatric community, but just to the universe. So we are excited to cheer you on and continue this conversation on all the places. And friends, we'll make sure that all of this information is linked in our show notes as well. Karen, thank you so much for joining us tonight. We love this conversation and we can't wait to talk with you again.
Thank you for having me. It's great to see you both.
Awesome. Bye, friends.
Bye, guys.
That wraps up another empowering episode of the Bari Nation podcast. If you enjoyed today's episode, keep the conversation going by joining the Bari Nation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at barination.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at barinationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.